Thinking about getting your teeth whitened? Hold on, because not everyone is good candidate for whitening. In fact, if you fall into certain categories, whitening might not work for you, or it could damage your teeth. Today, I'm breaking down exactly who should not get whitening, the science behind it, and what are other alternatives. And trust me, by the end of this video, you will know whether whitening is right for you or if you need a different approach. Before we dive in, if you want free advice on how to improve your smile, get whiter teeth, and make sure that your aesthetic treatment suits you, just hit that subscribe button. I will share expert tips on smile, aesthetic, and oral health and general health. Alright, first let's quickly go over what teeth whitening actually is. It's a process that uses carbamide peroxide or hydrogen peroxide to break down the stain on surface or inside of your enamel. We have two types of whitening, chairside whitening and home whitening. Chairside whitening is done by a dentist in one session using a strong whitening gel and often a light to accelerate the process. You will walk out with noticeably whiter teeth, but it can cause temporary sensitivity. At home whitening uses custom trays and a lower concentration of peroxide. It takes longer, usually a couple of weeks, but it is gentler, gives more control result. Now, if you are doing take-home whitening, you will typically have two options: daytime whitening and nighttime whitening. Daytime whitening uses hydrogen peroxide and it is worn for a shorter period of time, like 30 minutes or 1 hour during the day. Nighttime whitening contains carbamide peroxide, which releases the active ingredients more slowly, usually overnight. Both works, but if you have sensitive teeth, nighttime whitening might be better options for you because it's milder and it allows your teeth to recover. So how does whitening actually work? Both hydrogen peroxide and carbamide peroxide penetrate to the enamel and break down the molecules that causes a stain. These molecules scatter light differently, making your teeth appear darker. When it is broken, whitening treatment restores a lighter, more reflective enamel surface. Whitening only works on natural tooth, meaning if you have filling, crowns, or veneers, those won't change color. Now let's talk about the most important part: who should not get whitening. First, pregnant or breastfeeding women. There is not enough research on safety of whitening during pregnancy or breastfeeding, so it's best to postpone it altogether. If your gums are inflamed and bleeding, whitening can make things worse. You need to treat gum disease first before considering the whitening. If your teeth already hurt from hot or cold food, whitening can make the pain unbearable. If you have exposed roots due to gum recession, the whitening gel won't work on those areas. It might cause more sensitivity and irritation. If you have untreated decays, whitening can seep into cavities and cause nerve irritation. It's crucial to get any cavities filled before whitening. Let's just start with our oral health before we go to any aesthetic treatments. Like I said earlier, whitening only works on natural teeth. If you have multiple filling on your front teeth, you might need to redo them afterward to match the new shade. In some cases, composite veneers might be a better option. If your enamel is already weak, whitening can cause long-term damage and worsen the situation. Cracking teeth can also allow whitening gel to irritate the inner tooth structure and causing pain. If you are under 18, you need to wait until you get a little older. Teeth are still developing in younger patients and whitening can be too aggressive for them. Professional whitening is generally recommended after 18 years old, unless you have severe aesthetic problems that maybe it's better to consult with your own dentist. Whitening doesn't work the same for everyone. Some stains like tetracycline stain are very resistant to whitening. In such cases, other treatments such as composite bondings or veneers or internal whitenings may be indicated. So what can you do if you are not a good candidate for whitening? There are some alternatives. First, improve oral hygiene. Plaque and tartar can make your teeth look dull. Regular cleaning and proper brushing can brighten your teeth naturally. If whitening isn't an option for you, maybe veneers can give you a permanent whiter smile with a natural appearance. So if you were considering whitening, now you know exactly whether it's right for you or not, and what are your other alternatives. Let me know in comments what you are thinking about whitening. Thank you for watching.